Hello, everyone, and thank you for joining us this morning, this afternoon, this evening, depending on where you are. We are absolutely thrilled today to be hosting this webinar on the importance of community engagement and AMR, which marks the first in a series of webinars that we're hosting this week entitled Global to Local to Global, Building Awareness and Engagement on AMR. And today our session will focus on the critical and bilateral relationship between policy and people. My name, as you see, is Julia Bishop, and I serve as the Director of Global Engagement at the AMR Policy Accelerator. The accelerator is housed at the Global Strategy Lab in Toronto, Canada, and we use research and evidence to advise the world's governments, public health institutions, and decision makers on topics related to AMR and policy. While a lot of our work is done at the global, regional, and national levels, engagement with communities is an imperative to ensure that policy is translated into action and that governments are held accountable to their commitments. Ultimately, it is only when communities are meaningfully engaged that promises turn into practice. I'm therefore really delighted today to be joined by 4 leaders in this field who are with us to share their experience and expertise on some ways in which they have effectively engaged communities with the aim of addressing AMR. Before I introduce the panelists, I'm just going to give a few words around housekeeping. You will have seen a poll pop up as you entered the webinar, so please feel free to answer that so we get a sense of who is in the room and who is taking part in this webinar today. We're going to start with some short presentations from each of our panelists and then move into discussion followed by a Q&A. So if you have any questions, please feel free to put them in the Q&A box and we'll try to answer them during the session. And of course, please also feel free to introduce yourselves in the chat so we have a sense of who is in the room. We only have an hour together today, so I don't want to spend too much time setting the scene. I think our panelists will do more than a good job at that. So I want to welcome our panelists, and if you do want a more fulsome biography for each of them, please feel free to go to our website where we have a full biography, but I'm just going to give a quick one for each person. So starting off with Tapiwanashe Kujinga, who's a Zimbabwean lawyer and director of the Pan-African Treatment Access Movement, or PATAM. We also have Natasha Kapitula, who's a gender associate at React Africa, where she integrates gender perspectives into AMR programs across Africa. We have Dr. Andrea Caputo Svensson, who's a global health advisor at React Europe, where he works on strategies to address AMR through policy research and advocacy. And last but very much not least, we're delighted to have Oluwatomi Akinola, who's a public health professional driving health system strengthening with a focus on AMR, health policy, and science communication. She serves as the program manager at the DRASA Health Trust. So as you see, we have a really phenomenal group of panelists joining us with a wide array of expertise and experience. So really thrilled to have everyone joining us today in what is, I know, a very busy week with WOW being celebrated. So I'm going to turn over first to you, Tapiwa, to talk to us about the community engagement framework that PATAM has been working on.
Thank you so much, Julia. Sorry, I've been trying to look for my for the controls. Good morning, afternoon, good evening to everybody, and thanks so much for joining this webinar. So I'm just going to talk about the community engagement framework, which was developed by the Policy Lab in collaboration with the Pan-African Treatment Access Movement. And this framework was specifically, meant for engaging communities in Africa in order to stimulate an optimal community response to the pandemic. We know that, right now, our communities have got very little information or knowledge on AMR, and there's need to engage them in order to ensure that we do have a response from them. And most of these communities are really marginalized. If you look at the AMR data, which was recently released by the WHO, in the GLASS report, you realize that most countries with the burden of care are in low and middle income countries, and yet high income countries have got lesser burden, which means, there's something going on which needs to be addressed. So these marginalized communities, which have got a higher burden of AMR have got minimal access to healthcare and equally limited access to quality antimicrobials. And so there is need to communicate AMR to these populations, ensure that there's a tailored approach, which then emphasizes on community engagement and education. And I'm happy to note that most of our colleagues have got knowledge or experience on community engagement. So the framework has a number of crucial pillars, 6 pillars actually, which are developing and maintaining partners, ensuring culturally sensitive messaging, community asset mapping, effective engagement strategies, equity, and then using available resources. And there was quite a bit of desk research looking at best practices, and these were identified and included in the approaches, and they include the Welcome Trust responsive dialogue approach. So the first one, developing and maintaining partners. So this is quite important. There's need for stakeholder relationships and partnerships in order for successful community engagement. And we know that, if you're going to do any work which involves communities, and we've noted that from HIV, you need to have your community mapping, ensure that you know who is who and the community dynamics in order to create sustainable relationships. And collaborating with national and local authorities provides a crucial groundwork for forming community relations while boosting the visibility and credibility of the activities. And it's also important to partner with local stakeholders so that they open up networks, foster personal connections, and enhance credibility and facilitate community entry. Every community has got its own dynamics. You can't just go in there and you start implementing, but you need to have those, we call them doorkeepers, or gatekeepers rather, who then facilitate community entry, and they will show you exactly what is to be done, how it is to be communicated, and so forth. And partnering with local stakeholders also open up their networks and fosters personal connections. Sorry, that was replicated. So secondly, ensuring culturally sensitive messaging. Again, very important. We noted from the HIV experience that messaging needs to be tailored. It needs to be sensitive. What you can comfortably communicate in one community cannot be communicated in the other communities. That's those are the realities. So understanding the local context is very important. And participatory learning and action can also stimulate community action and unite people to address common issues, draw parallels with historical community campaigns for HIV prevention. So basically building on what has been done during the HIV era, will give you kind of like a pattern into how you frame, shape, and disseminate your messaging. And again, identifying and leveraging shared values and belief systems can promote positive practices and facilitate interventions. And finally, developing a local vocabulary through discussions with participants can address language barriers and provide insight into local behaviors. And whilst I'm talking about that, can we think about what is the local terminology for AMR in your community, using local, in local language? How do you communicate AMR? That will give you a sense of, the need to frame a vocabulary so that it becomes relevant to the communities. And then thirdly, community asset mapping. Okay, so localized intervention strategies that mobilize communities are most effective and sustainable when integrated into existing or developing public health systems and connected to other community programs. Okay, so the strategy here is to first of all, understand that communities have got their own innate strengths, right? And you are actually tapping into that capacity which has already been developed over centuries and over decades. Participatory action-oriented approaches combined with educational interventions can lead to lasting widespread improvements in knowledge and behavior. So you are plugging into what communities already know, and you're bringing in new knowledge. Conducting community mapping and gap analysis helps identify who is included, why, and who might be missing. And the early mapping of communities and stakeholders clarifies their relationships, roles, and needs, facilitating two-way knowledge exchange and fostering community ownership of the project. And then effective engagement strategy number 4. Engagement begins with transparent discussions about expectations and suitable incentives. And that's one very critical approach when you are conducting community engagement, because you want it to be a mutual or symbiotic process. You engage communities on a very level or equal basis. Effective AMR interventions depend on educating and upskilling a wide range of individuals, from farmers to healthcare workers to students. And when you are engaging in a One Health approach, which is the best practice in AMR, you obviously need to identify all the stakeholders who are important within human health, agriculture, animal health, and the environmental sector, so that you don't leave anybody behind. However, raising awareness alone is inadequate for lasting behavioral change. Sustained public engagement is crucial. So a helicopter approach, just coming in and going out, will not achieve the desired goal. We've seen that with HIV. There is need for sustained engagement. There is need for continued, technical support, so that, because especially with AMR, behavior change is going to take quite a long time to achieve. Successful engagement relies on flexible academic and community partnerships, cultural competence training, and involving community members in leadership roles. And investing in community engagement is essential for demystifying AMR, involving the public in designing interventions. We've tried to communicate AMR at our own level. It's not easy. You need communities to come to the forefront, and then you develop not only vocabulary, not only approaches, but also long-term interventions, because AMR is different from HIV. So equity, also very important. So when you are conducting community engagement, there is need to make sure that there is equity in the approach, especially when they are marginalized populations. Ensure that they have fair and just opportunities to participate in and benefit from initiatives. So you're not coming in as somebody who knows it all. The communities also have their own innate capacity, and you need to recognize that. So building trust and motivation within these communities is essential. And when designing community engagement research, understanding local power dynamics and investing in relation building amongst stakeholders is crucial, because you want their buy-in, you want their continued collaboration. And power imbalance is often stemming from expert knowledge, can result in top-down engagement approaches. It will result in communities feeling, misunderstood and feeling downtrodden, and there won't be any optimal, participation on their part. And then using available resources. So to engage communities sustainably and efficiently is vital to use or develop effective engagement models. Continuous multidimensional engagement supported by periodic assessments can enhance intervention durability. Again, multifaceted interventions typically yield better outcomes than single element approaches, highlighting the importance of comprehensive strategies. So the community engagement framework is available. There is actually a publication which will probably be out probably end of the month or in December, which will be shared in real time, so that you can enrich your knowledge and understanding on AMR community engagement. So that's my presentation, and back to you, Julia.
Thank you so much, Tapio. That was such a wonderful way to start and really set the scene for us as we delve into some more of these issues. I think you've touched on a lot of the sort of broader frameworks that our other panelists are going to speak to. I think we're just going to quickly, before we go to gender, share the poll results so that everyone can see who's in the room. So we have a good group of people that are either actively involved or have some involvement in community engagement already, and a smaller group who are new to this field. So welcome everyone, but that's really great to hear that most people present are already doing some of this work, and I hope that what you hear today resonates and enriches the work that you are doing. Tapiwa, you really highlighted the importance of incorporating equity deserving groups, and gender being a big one of those, and also the sort of need to incorporate voices that are not always heard. So I think that's a fantastic segue to Natasha, who's going to come in and speak to us about integrating gender into community engagement. So Natasha, over to you.
Thank you so much, Julia, and the GSL team for having us today. So my name is Natasha Kaptula, like as introduced, and I'm a gender associate at React Africa. And today I'll just be sharing practical insights on how we at React Africa integrate gender into our community engagement work and what we have learned from our implementations and just the different approaches that we have used to implement gender into community engagement. Next slide, please. So recent research has shown that gender is a key determinant of antimicrobial resistance, and I'm sure we've all come across different publications that have just highlighted that women and men do not experience AMR risks, exposures, or health-seeking patterns in the same way. And we know that women are 27% more likely than men to receive an antibiotic prescription, and sometimes this has been linked to gender bias diagnosis and treatment seeking expectations, but also the biological and reproductive health systems of women, such as pregnancy, menstrual health care, as well as just the fact that women are the carers in the home, and they're more likely to take care of the sick and hence have more access to antibiotics, but also are constantly in and out of the hospital, so they may be at risk of getting infections from the hospital. Research also shows us that 70% of women are frontline healthcare workers. Now, I know that most of the time when we speak about gender, it's mostly focuses on women, but it's also very important for us to understand that men also have a crucial role that they play in AMR mitigation, but also are at risk of AMR simply because of toxic masculinity stereotypes that exist in our society. Research has recently shown us that men are more likely to engage in risky behavior, and this risky behavior leads to poor immune systems, which could lead to infections and therefore the misuse or inappropriate use of antibiotics. Next slide, please. So to address these differences, our approach at React Africa is guided by gender responsive principles. We use tools such as the Gender Analysis Framework and the Gender Continuum Framework to understand how gender roles, decision-making, access barriers, and cultural norms influence AMR behaviors in the communities, as well as just ensure that our approaches move from being gender blind or being gender neutral to being gender responsive, as well as gender transformative. So we also apply a context of One Health lens and not just focus on human health, but also animal health, agriculture, and the environment. Our actions include some of our projects. We have introduced an AMR. We work in our AMR space. We've introduced the gender lens through community dialogues and different workshops where we have ensured that there's equal participation of men and women, just so that we can have vulnerable groups in society participate in our community engagement, and this helps us design better interventions. We have also ensured gender balanced participation in the different community awareness programs that we have in the different communities that we work in. We also have integrated a gender module into what we have, our AMR leadership program, which is a capacity building program that focuses on tertiary students in universities, where we really just help them understand AMR not only from a technical lens, but also an equity lens, which is very important for future prescribers and future policymakers. We've taken the deliberate initiative of just training REACT staff on gender-sensitive communication, and have also developed tailored material for women caregivers, youth groups, and men who are more likely to self-medicate. These are just materials that directly speak to the issues of these different groups that I have mentioned. In our work, we have picked many, many lessons, and I'll highlight a few. One of them is that gender shapes who receives information, who participates, who has access, and who makes decisions. And we've seen this from not only the research that has been done, but also the implementation of our work, and also in our governance structures. We see, or we are able to analyze how many women and how many men are there as members of parliament. So it's also, you are also able to tell what policies may go through and what may not go through, simply because of that desegregation in the policy space. Women, a lesson that we've also picked is that women also engage more deeply when activities consider the caregiving role that they play in society. Yeah, and also the needs that they face and things that they may need. Something that we noticed that had been left out was the integration of men really into our community engagement activities. And like I said, when we speak about gender, it's not just a focus on women, but also understanding the disparities that affect men. So we have created topics that speak both to men and to women, both young and old. One cardinal thing that we have learned is that gender is not a one-time activity that you need to have. Yeah, it's an ongoing process, and therefore should be embedded in your monitoring and evaluation through gender indicators that you're going to set. And this should happen from the point of planning your activities all the way to implementation and to the end. So gender is not just a one-time thing, and it's not just an add-on, but really should be there from the beginning of concept creation. Yeah. So collecting gender disaggregated data has really helped React Africa, because then we're able to understand how AMR affects men and how it affects women differently. Next slide, please. So these are just some of the highlights or photos from the different activities that we have in the different communities that we work with. You see on your right-hand side, this purple, nice photo here is just a call for our third cohort of the AMR Leadership Program, which will be coming to an end on Saturday. And when we were selecting participants, we made a deliberate move to have both males and females qualify for the program, because we want to educate both, or build capacity in both males and females. And our hope is to have a future of AMR champions that not only understand AMR from a technical lens, but from an equitable lens as well. We have the women in red, who are from some of our FBO engagements that we have. And this is a community group that we have worked with, where we educate women and just the vulnerable groups in society that have been left out in the past on the problem of antimicrobial resistance, the risks, and the steps that they can take to mitigate or reduce some of the risks, and just educate them on how it affects them, their families, and how their caregiving role really comes into play. So this is a women's focus group, but we also have right next to them both women and men, where we have created a safe space to where they can interact and share their lived realities or lived experiences. And there we have tailored messages to reach both men and women, understanding what AMR is and what they can do to mitigate, what role they can take to mitigate the problem of antimicrobial resistance. Right at the bottom, we have a photo that was taken. We have worked with women's groups in society, one thing that we've learned is it's very important for you to go through trusted organizations that already work in the community, because then there's a sense of trust already. So this is an organization, Young Women Christian Association, and they're already centered in many of the communities in Zambia, not just in Lusaka, but the entire Zambia, and they are women focused or women centered. They work with young children, males and females, and we have built capacity within their organization to just teach them about antimicrobial resistance and how it affects the different groups that they work with. And so this is them leading a conversation or an awareness session on antimicrobial resistance. And I think this is a very sustainable approach, because even when we're not there, they are able to take over the conversation and just highlight the problem of AMR in really simple messages of hand hygiene, IPC, wash, and the like. So with that, I would just like to say thank you so much for this opportunity, and that integrating gender into community engagement has really strengthened our ability to reach people equitably and responded to their lived experiences and realities, and also support communities to make meaningful action against AMR. Thank you.
Thank you so much, Natasha. And I think you did such a fantastic job of really highlighting what this looks like in practice with some real sort of lived experience examples. So thank you so much. And I saw so many through lines between what Tapua presented on around not having these interventions just be one-stop shops, but really having that continued sustainable engagement being so important, and highlighting, of course, the importance of equity. And I think it's a real testament to REACT's leadership in this field to even have a staff member who's dedicated to gender, to have a gender associate who's able to join our panel, I think really shows tremendous leadership. So thank you so much for joining us and sharing your experiences. I think we'll keep it in the REACT family, and I will call on Andrea to come in and share a little bit of a different perspective from some of the work that's been done on community engagement, linking to the sort of global level processes that have taken place over the past year. So Andrea, over to you.
Thank you so much, Julia, and thanks for inviting us and inviting even two speakers from REACT to present different type of perspectives, and I'll present more from a global perspective. And one initiative that we have been working on last year, called indeed From People to Leaders, which was done in the lead up to the UN high-level meeting on AMR. And you see down here who were part of this event and this collaboration that started indeed last year and that is continuing this year. But before moving on to the next steps, I also wanted to show here how everything started, and perhaps also inspire others to look into these different community engagement initiatives. So everything started from the Empowered Communities Initiative in Latin America. This was an initiative started in 2021, indeed in Latin America, by our team there, and looking into how they can engage different type of communities from the original populations to the more displaced and rural populations as well, and looking into different art forms as a way to engage communities. As we heard from the previous speakers as well, working also with youth, and youth champion has been quite important, and brought up to writing a declaration. Specifically in that case was for the Latin American, Caribbean countries, and we decided together with Latin America to indeed try to bring it to a global stage. How can we make sure that the approach that was taken there, that we saw it was so successful, could also be brought more globally? And that's how the call for action started. So the From People to Leaders, in this was a call for action, which came out from a consultation process with different communities and civil society organizations all over the world, looking into what kind of asks do community and civil society wanted towards policymakers. And this type of approach was also successful for the same reason, because it was indeed built together with and having direct input from communities and civil society organizations. Just briefly summarizing, the call for action had 10 specific requests to member states and their key stakeholders, and the focus, as we heard also from the previous speakers has been indeed on vulnerable population, equity, and One Health as the key pillars for bringing together all the different communities. What was also important for us was indeed to reach the widest audience, and that's why it was translated then in 6 different languages. And the most exciting results was indeed to see how much has been taken on and how much the campaign was successful since it started in April 2024 and ended September, right before the high-level meeting. And what you see here is a color-coded map and the shade of the color. So the darker is the color, the more a signature represents. And you can see here in the bottom part, the actual numbers. So over 800 signatures from community, civil society, and individuals, but specifically over 200 from communities and civil society organization and more than 85 countries. This was, in a way, an unexpected result, not because we didn't believe in the project, obviously, but because the narrative was that the AMR didn't have a community, perhaps like had HIV or the climate change. But instead, we found out that when there is a clear goal and a clear scope, people do come together, even in the AMR community. They just need to be clear on the objective and involve people from the very beginning. This also resulted in report that we published early this year, summarizing two decades of empowering communities. Inside the report, and I'll also share it after in the chat, you will find 4 different projects, and one of those is indeed the From People to Leaders. In there, you will find the idea of the project was also to both deep dive into these different projects and understand what has worked, what hasn't worked, what could have been done better, but also provide suggestions for others if they want to replicate. There is no need to replicate perhaps errors or mistakes. Let's just go straight to the point. And that's the scope of this report specifically. So I encourage everyone to have a look at it. But specifically when it comes to the From People to Leaders, what we saw was that in a way there was a limited high-level access. When it comes to the UN high-level meeting, we saw that the civil society had little direct engagement with the political leaders. So early outreach, for example, to the Ministry of Head of States is extremely important. So the engagements also need to start way earlier if we want to see a result than at the specific date or event. I think it was mentioned by someone before, but we still see this media gap in terms of how AMR is still framed as a very technical and medical issues, whereas we do need more human-centered stories, really think about treatment failures, and that can really boost visibility and have even more outreach. And last but not least, still we saw several structural barriers. We have also published some of these on our social media as well, in terms of UNGA being very state-centric. And it's important that when it comes to inclusion, civil society should be more formal inclusion moving forward in future processes. I also wanted to end on this note in terms of what we're going to do in the future. So it's important for us that the initiative is not just finish with the high-level meeting, but really bringing those lessons learned from the high-level meeting 2024 and bringing again now to the next important meeting, which will be the ministerial meeting in Abuja 2026 in Nigeria, indeed, where we're aiming also there to do a consultation process, dedicating more time learning from the lessons that I just mentioned from People to Leaders, let's say 1.0, and really bringing it to the next level, making sure that we manage to collect as many inputs as possible from as many diverse communities as possible. I'll stop here for now, just a teaser, but perhaps we can discuss more later. And yeah, perhaps I can also mention that for all of you that perhaps are not yet part of the From People to Leaders and want to be part of it, also looking forward to the ministerial meeting, please drop an email. You see my email address here. Over to you, Julia. Thank you so much.
Thank you very much, Andrea. And just to say that we will be circulating resources after this webinar, as well as the recording. So if you miss any of the documents or anything, we will be sharing those as well. And I think you've also highlighted in a slightly different kind of context the importance of continued engagement. That it's not just for the high-level meeting, but now we're on to the next big global meeting in 2026 in Abuja, and we need to be consistent with the messaging and having that real clear focus on what our objectives are. I think is fantastic. So thank you so much. We're going to shift gears now and head over to listen to Oluwatoni share some information about the Say AMR Language Hackathon. I'm really excited. I've seen a little bit of information about this initiative, but I'm really excited to learn more about it. And I noticed that that Tapiwa talked about the importance of language when we're engaging with communities, and I think that this initiative really speaks to that. So looking forward to hearing more, Oluwatoni, and I'm just going to pop in the chat some of the resources that people can access if they want to learn more about DRASA.
All right, thank you so much, Julia. Good morning, good afternoon, good evening, wherever you're joining from. I'm Oluwatoni Akinola, and I'm the AMR Program Manager at DRASA Health Trust, representing our Managing Director, Mrs. Niniola Williams. And I just, as Julia mentioned, like to speak about some of our initiatives. And a lot of the work we do at DRASA is very people-centered. It's very inclusive. And as you've heard from my co-panelists, it's important to make sure that people are at the center of the work we do. So for the Say AMR Hackathon, it's basically a youth-led national hackathon, and it's engaging university students nationwide to create local translations for antimicrobial resistance. And as you know, the term in itself, even if you do understand English, it can be quite abstract and quite foreign, right? So we're working on having university students form teams, collaborate, and come up with antimicrobial resistance in Hausa, Igbo, Pidgin English, and Yoruba, which are 4 of the main indigenous languages in Nigeria. And you may wonder why. So in Nigeria, there are over 500 languages, and it creates a communication barrier to understanding what AMR is. And it's important for us to have culturally accurate local terms that make information accessible for people. So what we hope to achieve is standardized AMR terminology in the 4 major languages, and just make sure that the youth are involved in this innovative way of coming up with public health communication. We hope that it can go on to inform other disease translations as well. And then it will provide a model for naming health phenomena in local languages nationwide. So we've done this in collaboration with the Nigeria Center for Disease Control and Prevention, the Committee of Vice Chancellors of Nigerian Universities. It's important to have them on board so that they can communicate the hackathon and get university students on board, and also with the Center for Infection Control and Patient Safety, which is housed in the University of Lagos. So again, it just shows that collaboration is essential. We're not working in isolation. Towards making sure that people across the country, across the continent as well, understand AMR. So because this was just launched last month, it's a bit early to say what the challenges are, but the successes so far has been strong interest by students. We've had information sessions, about 2 recordings of which you can find online. And just to give a bit more information about the hackathon, and I believe Julia will share or has shared, thank you, some of the links so you can check on our website about the hackathon. If you're a university student or no one in Nigeria, feel free to share it with someone, because the applications are still open. And I will just share an important project that we worked on earlier in our organizational history. So AMR, the AMR school program, supported by WHO, and also the Lagos and Osun state governments, DRASA established AMR clubs in 30 public secondary schools in Nigeria. And we had successes including over 800 student ambassadors trained in 1 year. And using baseline assessments and also endline assessments, we got to see a knowledge increase of over 100, so 161%. And these ambassadors went on to reach over 8,000 people in 6 months, teaching in assemblies, discouraging self-medication at home and with their friends, and sharing hygiene and infection prevention and control messages in religious institutions as well. And it just shows that through young people's boldness and creativity, they can leverage the trust that they already have with their communities to be able to translate AMR knowledge into action. And we know that challenges with teaching, whether it's adults or children, it can be difficult to engage them. So we made sure that we used innovative and creative ways of teaching. So dramas, debates, poetry, competitions, just to get them involved. And another challenge is also that different states have different educational terrains. So they may have different ways of teaching, different ways of having their curricular activities, and so different school schedules. So the plan from this, seeing the success we had with the AMR school program, we're working with the NCDC and other stakeholders in Nigeria to integrate, to harmonize rather, the already existing AMR curriculum nationwide and be able to integrate it into our school curriculum. And we're working hard at doing this, and we're making sure that the educational terrain is better explored, so we don't have issues of we're able to better navigate different styles of having curricular activities in schools. Yes, so I will stop there, and I'll just kind of summarize in the fact that youth are powerful change makers. Language matters, and it allows us to reach marginalized communities. Collaboration is essential, and sustainability requires institutionalization, and hence our push for the national AMR curriculum integration. Thank you.
Thank you so much for sharing that. And I think, again, we got the same themes around the need for trust in order to enact behavior change. The importance of language is obviously very central to that. And I'm sure we've all had experiences where as soon as you say the term AMR, people kind of glaze over and they don't know what you're talking about, and it becomes very technical when you start to explain it. So I think these innovative ways of really engaging youth and others in the community is so important. So thank you so much for sharing that exciting initiative. I think we're going to turn now to a bit of a discussion between our panelists. So I'd invite you, if you can, just to turn your cameras on, and we can just dig a little bit deeper into some of the topics that have been raised. Andrea, you kind of left off with a bit of a teaser or trailer around what's coming next. So I'd just be curious to unpack a little bit more the role that you see communities playing in the lead up to Abuja and beyond.
Yeah, thanks, Julia, and really good segue from the presentation as well. I think we heard several different key topics from all the speakers, so I didn't want to necessarily repeat what was mentioned before. But I think what is important to remember is really that in order to move forward and have a clear response, there is a need to identify what are the barriers for really engaging communities. And I think the one that actually can bring up what are the key barriers for even, for example, implementation of national action plans, it's communities. Another important topic that was brought up by Tapiwa in one of his points was about behavioral change. I think we sometimes do focus too much on raising awareness that we forget that actually in order to really see an ultimate change, which is long lasting, we do need a change in behavior. And their community also can be extremely important for multiple reasons. First of all, identifying leaders in the community that can bring up that message and having that message as clear as possible, and really understand what drives that specific change. And it can be like peer-to-peer education or local champions. We just heard now about the youth engagement. I totally agree with that. And that type of activism, extremely important. I also don't think we should forget about accountability and transparency. I think that's a role that both communities and civil society are supporting with. And I think this is extremely important because they keep governments or the state, depending which context we're discussing here, accountable for example, implementation of one of the topics that was discussed earlier today was water hygiene and sanitation, which is extremely important in certain types of communities. And perhaps one last point is really about co-creating those solutions. So I still think there is a huge role, and that's what we're going to focus on, co-creating solution, co-creating a call for action, co-creating a messages together with community that speaks about communities.
That's great. And I think this whole idea of sort of identifying leaders who can then serve as kind of leverage points or really impactful and important people in conveying these messages, because ultimately we aren't in every community all the time, and so to be able to kind of have those key central people, I think is so crucial. You started talking a little bit about barriers, and I know Tepiwa, you've worked in HIV before and in many other fields. I'm just curious to know from your experience with PATAM or previously, what are some of the biggest barriers to effective community engagement, and how have you overcome those, whether it be with AMR or in previous capacities?
Okay, so I've always pointed out, AMR is completely different from HIV. It's different from COVID-19. AMR or resistance does not make you sick. So it's very difficult to communicate, especially, in our settings, a condition which does not have any visible symptoms. And the main challenge is to achieve behavior change, because then, if there is no kind of like motivation, if the communities cannot really grasp the essence of resistance, then, behavior change is going to take a long time to achieve. That's one aspect. And the second aspect really is that, whether we like it or not, there are a number of technical issues within AMR which need to be toned down in order for communities to be able to understand exactly what it is. I think it was last year, the Global Fund asked me to do a paper on AMR targeted for communities. And it was so difficult because the more I tried to tone down the language, the more they continued saying, it's still very technical. So I think, we have to probably try, like I said in my presentation, to try and work on new vocabulary with communities to ensure that the language is understood in a very clear way, in a way that will be able to induce behavior change. Yeah, so that's, my take on that, and back to you.
Thank you very much, Tepiwa, for sharing those insights. And you highlighted language again, which I know Oluwatoni has spoken about too. So I'm going to pass it over to you, Oluwatoni, if that's okay. What pathways have you seen being successful in having communities inform policy and policy being responsive to community needs and priorities? So a bit of that kind of bidirectionality between people and policy that sometimes gets missed.
Thank you so much. So at DRASA, we prioritize an inclusive, people-centered approach to preventing illness, improving healthy behaviors, and ensuring safer, healthier, more resilient communities. And we bring this lens to all the work we do. And I think a particular example is the development of facilitating the development of the AMR National Action Plan, the second version 2.0. So as we led the process, we're able to ensure the inclusion of civil society and youth groups as well, demonstrating the importance of community feedback. Pardon me. Demonstrating the importance of community feedback in shaping policies. And we ensure that the lessons learned from the development of the first NAP were incorporated into the process, and ultimately ended up engaging about 146 stakeholder groups to ensure a diverse and inclusive approach to identifying priorities for the 5-year plan. Also, before we embarked on the development of the NAP as well, we supported the development of the One Health situational analysis, which involved gathering AMR data, insights from all over the country, so that we could just have a clear picture of the burden of AMR, the challenges that communities and individuals face to inform the NAP. So I think that's an example of how community feedback has shaped policies. And then we continue to see communities informing policy, for example, through pilot-first approaches. So evidence from pilot programs provides data to inform policies. And an example of this is DRASA's AMR school program, which provided key insights into the process that we're now working on of integrating AMR into secondary school curricula nationwide. And without that pilot program, we would basically be just relying on theory, but we have a bit of the practical experience of how we can roll out integration of AMR curricula in schools. And then also youth in, the second thing I'll mention, the second pathway is youth in AMR and One Health structures. So we know about the 2024 UN General Assembly high-level meeting on AMR, the Youth Manifesto, the Africa CDC Youth Advisory Team for Health, and then the recently developed Africa CDC Youth Engagement and Participation in Global Health Strategy. And it all signals like increased space for young voices in high-level decision-making. And in Nigeria, we recently developed, alongside Alliance for Sustainable Livestock, we developed Youth Pali, which is Youth for Pandemic Alliance. And it's basically a way for youth to have the capacity developed so that they can be embedded in AMR and One Health governance structures. And that's an example of community needs just being able to translate to policy as well. And the last I'll mention is the recognition of the role of CSOs. An example of this is the recently inaugurated WHO Civil Society Task Force on AMR, of which DRASA is a member, and our managing director, Mrs. Niniola Williams, is a steering committee member as well. And it just shows that CSOs play a role in community listening and amplifying community voices. And it's a great pathway to inform policies for AMR as well. Yeah,
that's great. And great to hear that you're going to be represented on that steering committee by Mrs. Williams. It's actually something that Niniola said during a course at React Africa last year around sort of how important it is for community engagement to be done meaningfully and not tokenistically. And that's actually a question I had for you, Natasha, given that you work in the gender space. How can we make sure that when we engage with community members that it's not done for show, that it's not done tokenistically, but that it really is done meaningfully? You're on mute.
Apologies for that. So if I heard you right, an action that can be taken to make community engagement more meaningful for historically excluded groups. Is that what you asked?
Yes, exactly.
Okay, and I'll just highlight that some of these historically excluded groups are women, youth, people in the informal workspace, and also people living in rural areas. I think one thing that we can do as people that work within the community is really just to create an environment where they can genuinely participate and really become co-creators of these AMR solutions that we want to implement in their communities. And this can be done by meeting the people in their own spaces, not having meetings in places where they need money to go, but actually taking the meeting to their own space and the community markets that they work in, the community church groups that they have, but also something that we have seen work from the React Africans end is going into the community through organizations, trusted organizations that exist within their communities. Like I gave the example of Young Women Christian Association. They already have groups where they meet women's groups, youth groups, and they already have awareness sessions with them. So just have the program embedded in some of these already existing groups in the community, which encompass the vulnerable or historically excluded groups that are there. Something else that has worked is really just have facilitators that they can relate to, have people from their communities that will facilitate this program that you have or lead these community sessions that you have. And some of these facilitators can come from their churches. This makes interactions even better. It feels like they're speaking to people that really understand the problems and the lived experiences things that they have gone through, their lived realities. Yes, and also just using local language, because communication is such an important key. It's the only way to get through to someone is through really speaking and ensuring that they understand what you're saying. But we have this jargon of AMR, and the moment you say AMR, antimicrobial resistance, it becomes so difficult for the next person to understand. But like something that Oluwatoni has said is really maybe bringing it down to their language, helping them understand it from their own perspective, and just simple messaging, and that could help and just make it more meaningful for historically excluded groups. Thank you.
Thank you so much, Natasha. I'm conscious that we only unfortunately have 5 minutes left, and I'm sure a lot more to cover. We have 2 questions that have come in through the Q&A, one from Anmar Taba and one from Babukar Sise, which I think actually are sort of 2 questions of the same coin. So one question is around sustainably engaging communities. So how can we make sure that that communities remain sustainably engaged? And on the flip side of that, how do we make sure that we're sustainably investing in community engagement to make sure that the people doing the work, leading the work, such as yourselves, can continue doing their work and be paid for it, and make sure that they can continue doing it, not just out of passion, but also sort of professionalism. So I'm not sure who would like to maybe take a stab at one or both of those. Andrea, I see your hand up. Please go ahead.
Yeah, maybe I can just give a brief answer. I think excellent questions, both of them. Probably the first one, I would say, also tapping into what type of activities and campaigns. I think it goes down to what was mentioned now in terms of communicating the issue, right? In a way, if AMR, as we said, it's a very technical term, perhaps one can even try to explain it more from the untreatable infection point of view. I think when we go down to that line in terms of even simpler infection or more common infection, like it can be a wound infection or UTIs, up to, as we know, cancer treatment, those are affected by antibiotic resistance. So taking that aspect into account, I think it does help everyone to understand. Everyone knows what an infection is most of the time. So I think that helps quite a lot. And to have a broader engagement or a long-lasting engagement, I think peering and collaborating with civil society, I think Tony was mentioning that also before, civil societies are there indeed to make sure that those voices of those that cannot be heard, for example, by politicians, can be amplified. So really doing perhaps that exercise of understanding what civil societies are around you, or even like working globally. Of course, I'm mentioning REACT because we are in different continents, but we are not the only one, right? So really try to find which civil society is working within or closer to your community and what can be done within that context. Over.
Thanks so much, Andrea. And Oluwatoni, I'll give you the final word here.
Okay, thank you so much. So just on the first question, as much as I'd want to say, okay, these are the kind of activities or campaigns, I think the first thing to note is it's important to make sure that the communities that you want to have these activities and campaigns in are involved in the development of the activities. They're active participants in it. So what do they actually need? And just making sure that it's context specific, whatever campaigns are rolled out, whatever activities are done, so that it's not just a kind of swooping in, trying to help thing that we do. It's more, okay, what do the people need? Do they need to understand AMR through education? Do they need to understand AMR through some activities that need to be done? It can be sensitization activities, it can be whatever, but I think instead of prescribing what exactly it should be, it's just important to make sure they're involved. And on the second question, I think it's great to just commit to the work and see what follows. So it's important work that's done in AMR advocacy, and just giving it a go is definitely worthwhile. And just seeing what follows, I'm sure it will be fruitful. So that's what I'll say to that. Thank you.
Thank you so much. And I think that's a very positive and optimistic way to end off today. So really appreciate those comments and insights, and all of our panelists today for joining us, Oluwatoni, Andrea, Natasha, Tapiwa, really hearing your insights and expertise, I think, has been certainly for me enriching and illuminating, and I hope for also those of us who are able to join today. We, as I said, will also be circulating a recording of this, so anyone unable to join will also be able to do so, and we'll be circulating resources for you to follow up. Please feel free to reach out to us. We're happy to connect you if you have more questions for any of the panelists or for anyone on our team. I'd also encourage you, tomorrow we're going to be running another webinar on art and access in AMR, which should be really exciting and interesting. So please sign up. I'll put a link in the chat there for everyone. Join us, participate, get involved, and always fantastic to have people join our AMR Policy Accelerator webinar. So I will close off there, thanking our team again, who's been working in the background to make everything run smoothly, and our fantastic panelists. So thank you so much, and hope to see you all tomorrow. Bye, everyone.